We will briefly discuss how to determine if your patient with active Hep C is eligible for treatment by you, the PCP using novel agents, or requires a referral to gastroenterology. We will also cover how to properly initiate treatment, follow up, and provide some resources to support you on this rewarding endeavor. This presentation is intended for use by PCPs in the Ventura County Healthcare Agency. First off, having a preferred pharmacy and dedicating a care manager is recommended as they will help you navigate the required paperwork and coordinate patient care. There are many novel medications on the market and coverage is insurance specific. Both Ventura County Health Plan and Gold Coast prefer Mavyret as a first-line agent as of now. New medications are being released all the time, so either keep up to date with our website or touch base with the payer prior to initiating therapy. For your initial evaluation, start by ordering a viral load if antibody positive. Remember, up to 20% of patients will spontaneously clear the infection on their own. So before embarking down this path, please ensure your patients have an active viral load. Once you have confirmed an active viral load, order the following tests and imaging. Ensure hepatitis A and B immunity or start immunizations. Note, you do not have to complete the immunization schedule, but just have to have it started prior to initiating treatment. This dot phrase and more can be found on the website listed below, which I will refer to a few times during this presentation. The dot phrases are pre-written templates, which will help guide you through the process. Once you have all of your labs and imaging back, please follow the link noted here to run the risk assessment tool that we have developed to help you determine if you should treat this patient or refer them to a gastroenterologist. If your risk assessment tool prompts you to treat, follow the link noted here to access our dot phrases for your treatment visit. If using Mavyret, there are two treatment regimens. If the patient is non-cirrhotic, fibrosis score 0 to 3, then treat with Mavyret for 8 weeks. If they are a compensated cirrhotic, Child-Pugh A, then treat with Mavyret for 12 weeks. If using another novel drug, please refer to the manufacturer for length of treatment recommendations. Here you will find the outlined lab and follow-up schedule for both the 8 and 12-week regimens. Of note, most patients will have a significant reduction in their viral load at week 4. If they do not, then recheck a viral load at week 6. If they had an appropriate response at week 4, there is no need to repeat the viral load at week 6. Follow-up and surveillance. At 20 or 24 weeks, dependent on treatment regimen, post-completion of therapy, order a viral load test to verify the patient has achieved a sustained virological response. If viral load is undetectable, congratulations, your patient is cleared of their hepatitis C infection. So let's go ahead and try the process out for a sample patient. This is a 56-year-old male with a history of IV drug use and Gold Coast insurance. He has a viral load of 816,000. He does not have HIV or Hep B concurrently. He has been treated previously only with interferon. He is not on any immune modulating medications. He has a fibrosis score of 2 but does have cirrhosis and Child-Pugh A. Now that we have all our critical labs, let's walk through the risk assessment tool. This patient does have an active viral load. He does not have HIV or hepatitis B. This patient has been treated in the past, which as you see prompts another question. Was this patient treated with interferon only, meaning no novel medications? And we'll say yes. Does this patient take any immune modulating medications? We'll say no. And the patient's fibrosis score is entered. Our next question is, does this patient have cirrhosis? And he does, and this again prompts us to another set of questions. And we will say this patient is a compensated cirrhotic, which again prompts us to another question, what their Child-Pugh score is. You can click on that hyperlink where it says here, and you can run a Child-Pugh on them. This patient has a Child-Pugh A score. We will submit the quiz and show that the output is that this patient is eligible for treatment by primary care. This risk assessment tool is available on our website, and we recommend everybody use it to help triage treatment. Given our patient is PCP treatment eligible and is a compensated cirrhotic, we'll send a prescription for Mavyret using our preferred pharmacy, which in the case of AFMC is CVS Caremark. Our care manager will provide some medication teaching, and we'll follow the labs as outlined in slide 6. Given the high SVR of these new medications, we anticipate a cure and SVR at week 24. It's really that easy. Follow this link below to access the dot phrases and instructions noted herein. Lastly, feel free to reach out to either myself or Dr. Underwood for any questions or assistance. Treating hepatitis C with novel agents in your primary care office is quite straightforward and very rewarding, and we really hope this empowers you to start treating. Thank you for your time.